Today we'll be talking about thyroid cancer. Thyroid cancer is a growth of cells that start in the thyroid. The thyroid is a butterfly-shaped gland located at the base of the neck, just below the Adam's apple. The thyroid produces hormones that regulate heart rate, blood pressure, body temperature, and weight. Thyroid cancer may not cause any symptoms at first, but as it grows, it can cause symptoms and signs such as swelling in your neck, voice changes, and difficulty swallowing. Several types of thyroid cancer exist. Most types grow slowly, though some types can be very aggressive. Most thyroid cancers can be cured with treatment. Thyroid cancer rates seem to be increasing. That increase may be caused by improved imaging technology that helps healthcare providers to find small thyroid cancer on CT and MRI scans done for other conditions. Thyroid cancers found in the way are usually small cancers that respond well to treatment. What are some symptoms? A lump that can be felt through the skin on your neck, a feeling that close-fitting shirt collars are becoming too tight, changes to your voice, including increased hoarseness, difficulty swallowing, swollen lymph nodes in your neck, pain in your neck and throat. If you feel any of these symptoms, or you see any of these symptoms, or someone you may know sees the symptoms, contact your healthcare provider and get the help and or treatment that you need. Just be safe, dogs. Just every so often check your shits. What causes this? Thyroid cancer happens when cells in the thyroid develop changes in their DNA. Cell's DNA contains instructions that tells the cell what to do. The changes with doctors called the mutations tell the cells to grow and multiply rapidly. The cells go on living with healthy cells would naturally die. The accumulation cells form a mass called a tumor. The tumor can grow to invade nearby tissues and spread to the lymph nodes in the neck. Sometimes the cancer cells can spread beyond the neck to the lungs, bones, other parts of the body. For most thyroid cancer, it's not clear what causes the DNA change that causes the cancer. Thyroid cancer is classified into types based on the kinds of cells found in the tumor. Your type is determined when a sample of tissue from your cancer is examined under a microscope. The type of thyroid cancer is considered in determining your treatment and prognosis. Types of thyroid cancer include differentiated thyroid cancer. This broad category includes types of thyroid cancers that start in the cell that produce and store thyroid hormones. These cells are called follicular cells. Differentiated thyroid cancer cells spread similar to healthy cells when viewed under a microscope. Papillary thyroid cancer. This is the most common type of thyroid cancer. It happens at any age, but it most often affects people ages 30 to 50. Most papillary thyroid cells are small and respond well to treatment. Even if the cancer cells spread to the lymph nodes in the neck, a small portion of papillary thyroid cancers are aggressive and may grow to involve structures in the neck or spread to other areas of the body. Follicular thyroid cancer. This rare type of thyroid cancer usually affects people older than 50. Follicular thyroid cancer cells don't often spread to the lymph nodes in the neck, but some large and aggressive cancers may spread to other parts of the body. Follicular thyroid cancer most often happens to the lungs and bones. Follicular thyroid cancer most often spreads to the lungs and bones. Hürthle cell thyroid cancer. This rare type of thyroid cancer was once considered a type of follicular thyroid cancer. Now is considered its own type because the cancer cells behave differently and respond to different treatment. Hürthle cell thyroid cancer are aggressive and grow to involve structures in the neck and spread to other parts of the body. Poorly differentiated thyroid cancer. This rare type of thyroid cancer is more aggressive than other differential thyroid cancers and often doesn't respond to usual treatment. Anaplastic thyroid. This rare type of thyroid cancer grows quickly and can be difficult to treat. However, treatment can slow the progress of the disease. Anaplastic thyroid cancer tends to occur in people older than 60. It can cause severe signs and symptoms such as neck swelling that worsens very quickly and may lead to difficulty breathing and swallowing. Medullary thyroid cancer. This rare type of thyroid cancer begins in the thyroid cells called C cells, which produce the hormone calcitonin. I'm not saying that right, I know it. Elevated levels of calcitonin is in the blood can indicate medullary thyroid cancer at a very early stage. Most medullary thyroid cancers are caused by a gene called RET, that's passed from parents to children. Changes in the RET gene can cause familiarly medullary thyroid cancer and multiple endocrine neoplasms type 2. I'm sorry, dogs. I'm butchering the style of these names. I'm sorry. Increase the risk of thyroid cancer, adrenal glands cancer, and other types of cancer. I'm so sorry for that. Oh my god, damn. That was a lot of big words. Just shoved it right at you, dog. So I'm sorry if I butchered that. I'll put them on the screen for you guys so you're not like, what the did you just say, bro? You know what I'm saying? Okay. Other very rare types of cancer can start in the thyroid. These include thyroid lymphoma, which begins in the immune system cells of the thyroid, and thyroid sarcoma, which begins in the connective tissue cells of the thyroid. Risk factors: female sex. Thyroid cancer occurs more often in women than men. Experts think is may be related to the hormone estrogen. People who are assigned female sex at birth generally have higher levels of estrogen in their body. Exposure to high level of radiation. Certain inherited gene syndromes. Complications. Thyroid cancers that come back. Thyroid cancers can return despite successful treatment, and it can even come back if you've had your thyroids removed. This could happen if cancer cells spread beyond the thyroid before it removes. Most thyroid cancers aren't likely to reoccur, including the most common types of thyroid cancer: papillary thyroid cancer and follicular thyroid cancer. Your healthcare provider can tell you if your cancer has an increased risk of reoccurring based on the particulars of your cancer. Reassurance is more likely if your cancer is aggressive or if it grows beyond your thyroids. When thyroid cancer reoccurs, it usually found in the first 5 years after your initial diagnosis. Thyroid cancer that comes back still has a good prognosis if often treatable, and most people will have successful treatments. Thyroid cancer may reoccur in lymph nodes in the neck, small pieces of thyroid tissue left behind during surgery, other areas of the body such as the lungs and bones. Your healthcare provider may recommend periodic blood tests or thyroid scans to check for signs that the cancer has returned. At these appointments, your provider may ask if you're experiencing any signs and symptoms of thyroid cancer reoccurrence, such as neck pain, a lump in the neck, trouble swallowing, voice changes. Thyroid cancer that spreads. Thyroid cancer sometimes spreads to nearby lymph nodes or to other parts of the body. The cancer cells that spread might be found when you're first diagnosed, or they might be found after the treatment. The great majority of thyroid cancers don't ever spread. When thyroid cancer spreads, it most often travels to the lymph nodes in your neck, lungs, bones, brain, liver, and skin. Thyroid cancer that spreads might be detected on an imaging test such as a CT scan or MRI. When you're first diagnosed with thyroid cancer after a successful treatment, your healthcare provider might recommend follow-up appointments to look for signs that your thyroid cancer has spread. These appointments might include nuclear imaging scans that use a radioactive form of iodine and special camera to detect thyroid cancer cells. Preventions, doctors aren't sure what causes the gene changes that lead to most thyroid cancers. So there's no way to prevent thyroid cancer in people who have an average risk of the disease. Preventions for people with high risk, adults and children with an inherited gene that increases the risk of medullary thyroid cancer may consider thyroid surgery to prevent cancer. Discuss your options with a genetic counselor who can explain your risk of thyroid cancer and your treatment options. Preventions for people near nuclear power plants. A medication that blocks the effect of radiation on the thyroid is sometimes prevented to people living near nuclear power plants in the United States. The medication could be used in the unlikely event of a nuclear reactor accident. If you live within 10 miles of a nuclear power plant and are concerned about safety precautions, contact your state or legal emergency management department for more information. I can't imagine that. Oh, damn. Okay. Alright, guys. Hope you guys enjoyed. I know there's a lot of big words in there, but I usually put them on screen so you guys know what I'm talking about, so you guys aren't clueless of what I'm trying to talk about. Hope you guys enjoyed this one. If you did, make sure you give it a thumbs up. Hit that subscribe button to post notifications so you never miss out. And make sure you share this video and every other video that may have helped you in some way, shape, or form. I love you guys. Stay safe. I will see you in the next video.